Most people do not expect a conversation about constipation to reveal much about their overall health. It feels like a simple problem, a frustrating one, certainly, but still just a digestive issue. You go less often than you used to. The stool feels harder. You spend more time in the bathroom. Maybe you strain a little more. Maybe you leave feeling like things were not quite finished. For many adults over 60, these changes happen gradually. So gradually, in fact, that they often become part of the background of daily life. People tell themselves, "I'm getting older. My digestion is just slowing down," and sometimes that may be true. But here's what many people miss. Constipation after 60 is not always just about digestion. Sometimes it can be a clue about hydration, daily habits, movement, medications, supplements, or other changes happening in the body. That does not mean you should panic. Most cases of constipation are not a medical emergency. But it is worth paying attention to, especially when a change is new, persistent, or different from what is normal for you. Before we go further, a quick reminder, this video is for education only and is not medical advice. Constipation, bowel changes, abdominal discomfort, medication side effects, appetite changes, and weight changes can have many possible causes. If symptoms are severe, persistent, or getting worse, talk with a qualified healthcare professional. One reason constipation can be easy to overlook is that many people think it only means not having a bowel movement often enough. But constipation can show up in several ways. You may still be going regularly, yet the stool is harder than it used to be. You may need to strain more. You may feel uncomfortable or feel as though the bowel movement was incomplete. Some people describe a feeling of blockage, others simply notice that something has changed. The change may seem small at first, then weeks pass, then months, and before long, what once felt unusual begins to feel normal, but the timing matters. When a pattern develops, the question is not only what is happening in the bathroom, the question is why it may be happening. As we get older, many aspects of daily life change at the same time. Retirement changes routines. Activity levels may decline. Meals may become smaller. Hydration habits may shift. Medications are often added. Health conditions may become more complex. Each change may seem minor on its own. Together, they can have a noticeable effect on bowel habits. One of the simplest examples is routine. The body often responds well to consistency. Regular meals, regular movement, and regular bathroom habits create a rhythm that many people rarely think about until it changes. When that rhythm is disrupted, bowel habits can change too. Sometimes people ignore the urge to go because they are busy, traveling, caregiving, or simply waiting until it feels more convenient. Occasionally, that may not matter much, but when it becomes a habit, the body signals can become easier to miss. Here's what many people miss. Constipation is not always caused by one major problem. Sometimes it develops from a collection of small changes that slowly add up over time. Hydration is a good example. Many older adults drink less fluid than they realize. Some do not feel thirsty as often. Others intentionally reduce fluids because they are worried about bladder issues or nighttime bathroom trips. Some may have health conditions where fluid intake requires special guidance from a healthcare professional. This is why blanket advice can be misleading. The answer is not always as simple as drink more water. For some people, fluid needs should be discussed with their doctor. The more useful question is whether your hydration habits have changed compared with a few years ago. Are you drinking less than you once did? Have you been avoiding fluids? Have medications changed? The goal is not to diagnose yourself. The goal is to notice patterns worth discussing. Food choices deserve the same kind of attention. Many people immediately think about fiber when constipation comes up. Fiber is certainly part of the conversation, but it is not the entire story. As people age, eating habits often change. Cooking may become less frequent. Appetite may decrease. Dental issues can make certain foods harder to enjoy. Convenience foods sometimes replace meals that once included more fruits, vegetables, beans, or whole grains. None of these changes automatically cause constipation, but they can contribute to a pattern that becomes more noticeable over time. That is why it can be helpful to look honestly at what your typical week of eating looks like today compared with what it looked like 10 or 15 years ago. Another piece of the puzzle is movement. Most people think about movement in terms of muscles, balance, or heart health. They do not always connect it with digestion. Yet the digestive system does not operate independently from the rest of the body. When activity decreases because of arthritis, pain, fatigue, illness, balance concerns, or simply spending more time sitting, constipation may sometimes become more noticeable. This is not about intense exercise programs or unrealistic goals. It is simply a reminder that movement and digestive health often influence one another. And then there is medication. This is one detail that changes how many older adults should think about constipation. Many people over 60 take several prescription medications. In addition, they may use vitamins, supplements, sleep aids, allergy medicines, pain relievers, stomach remedies, or other over-the-counter products. Certain medications can sometimes contribute to constipation. In some cases, combinations of medications and supplements may make it more difficult to recognize what is happening. That does not mean medications are harmful. Many medications play an important role in protecting health and improving quality of life. The goal is not to create fear. The goal is awareness. If constipation appeared after a new medication was started, after a dosage change, or after adding a supplement or over-the-counter product, that timing is worth paying attention to. The key is to notice the pattern. Healthcare professionals can often provide better guidance when they understand when symptoms started and what changes happen around the same time. A simple statement like, "I noticed this shortly after my medication changed," can be far more useful than many people realize. Another common mistake is treating constipation as too embarrassing to discuss. People often talk comfortably about blood pressure, cholesterol, sleep, or arthritis. Yet bowel habits remain one of the topics many people avoid. There is no need for embarrassment. Your doctor has heard these concerns countless times. Your pharmacist has heard them too. And sometimes a conversation that feels awkward for 30 seconds can provide answers that improve comfort for months or years. Before we talk about warning signs, it helps to think about observation rather than assumption. Instead of immediately assuming constipation is caused by age, pay attention to what is actually happening. Has your frequency changed? Has stool become harder? Are you straining more often? Do symptoms come and go? Or are they becoming more consistent? Did anything change before the symptoms started? Your meals, your fluid intake, your activity level, your medications, your supplements. The more clearly you can describe the pattern, the easier it becomes for a healthcare professional to help identify possible contributors. There are also situations where constipation deserves more immediate attention. This is something to discuss with your doctor, especially if it is new or getting worse. You should seek medical advice if constipation is accompanied by severe abdominal pain, vomiting, blood in the stool, unexplained weight loss, fever, significant appetite changes, or symptoms that continue for weeks without improvement. Likewise, if you feel blocked, cannot pass stool or gas, or notice a major change from your usual bowel habits, it is important not to ignore those signs. The purpose of mentioning these warning signs is not to alarm you. It is simply to help you recognize when constipation may be more than an inconvenience. Most of the time, the most useful approach is not guessing. It is observing, tracking, paying attention. Notice what happens. Notice when it happens. Notice what changed before it happened. Then bring that information to a healthcare professional. You might ask whether medications could be contributing. You might ask whether a recent change in routine matters. You might ask which symptoms deserve closer attention. Those are practical questions. responsible questions, and they often lead to more helpful conversations than simply assuming constipation is an unavoidable part of getting older. The deeper message here is not really about bowel movements, it is about listening to your body. Many of the most important health clues after 60 do not arrive dramatically. They appear quietly, gradually, almost politely: a little less energy, a little less balance, a change in sleep, a change in appetite, or a change in digestion. None of these automatically signal something serious, but they may be worth understanding. Constipation after 60 is not always just slow digestion. It may reflect changes in hydration, food choices, movement, medications, supplements, daily routines, or other aspects of health that deserve a closer look. This video is for education only and is not medical advice. Constipation and bowel changes can have many possible causes, and only a qualified healthcare professional can evaluate your individual situation. If symptoms are new, severe, persistent, or worsening, please seek medical guidance. And never stop, start, or change a medication without professional advice. The good news is that paying attention does not require fear. It requires awareness, the willingness to notice patterns, the willingness to ask questions, and the willingness to bring those questions to the right professional. Because after 60, protecting your health is often less about reacting to emergencies and more about recognizing the small signals that quietly shape your comfort, confidence, and independence every day.